Well, good afternoon, or morning, and thank you for joining us here today. I'm speaking today from the traditional territory of Treaty 6, and I acknowledge the Métis people who share a deep connection with this land. Proud to be joined today by Leslie Thompson from Pump for Life, and a proud advocate who continues to advocate for Albertans with diabetes. We're here to call on the UCP to release a consultation plan for the Insulin Pump Therapy Program and for the UCP to explain why the program was canceled at all, given new information about lobbying related to the program. According to the lobbyist registry, the lobbyist firm Pathway Advisory Services represented the medical technology company Tandem to lobby the Premier's office, Alberta Health, Alberta Seniors and Housing, and the Legislative Assembly of Alberta to make changes to the Insulin Pump Therapy Program. They first registered in September, and the subject of lobbying was specifically to seek changes for public coverage for insulin pumps and supplies marketed by their client. When the UCP originally announced the cancellation of the Insulin Pump Therapy Program on May 2nd, they said it was to make newer technology more accessible. Now, it's perfectly legal for a company to lobby the government to advance their business interests, but what's problematic is that the UCP canceled the Insulin Pump Therapy Program after meeting with these lobbyists, but without meaningful consultation from Albertans with type 1 diabetes. It's also clear from the disastrous rollout of this cancellation that Jason Copping and the UCP had given no thought at all to what this would mean for patients. We're calling on Jason Copping to release the contents of his meetings. He must also release the full plan to consult with Albertans who rely on the Insulin Pump Therapy Program. Since the program was canceled and then the cancellation was paused, the UCP have had one public meeting, which was heavily criticized by attendees for spending more time promoting the UCP's proposed changes than meaningfully consulting with the people who have type 1 diabetes. Now, Leslie will go into more detail about this, but the minister has yet to meet with the advocacy group Pump for Life, even though they've made many requests. If the government has time to meet with lobbyists who want to boost sales for their clients' technology, the government has time to meet with people with diabetes. It's episodes like this that underscore that Albertans simply cannot trust the UCP with their health care. Many who rely on the Insulin Pump Therapy Program are worried that the UCP's pause of canceling the program is merely a stall tactic, and that they intend to simply move forward again with their plan of cancellation. Without a public consultation plan and some willingness from the minister to actually meet with the community, there's no reason we should take him at his word. Alberta's NDP is committed to protecting the Insulin Pump Therapy Program in its current form, and if we have the opportunity to form government, we will consult with Albertans with diabetes to make the program stronger from the starting point that no one will lose what they already have. I'm now happy to turn things over to Leslie.
Thank you, David. Hi, I'm Leslie Thompson, and I'm the co-founder and organizer of Pump for Life, as well as I've been living with type 1 diabetes for 27 years, and I am on an insulin pump. Pump for Life represents over 4,000 type 1 diabetics. We were founded close to 2 months ago when the UCP government announced that the Alberta Insulin Pump Therapy Program would be ending in its current form. We started this group as we needed to speak up. Diabetics on insulin pumps here in Alberta needed someone to advocate for this treatment. The Insulin Pump Therapy Program is a vital program for over 4,000 type 1 and type 3C diabetics who rely on insulin pump therapy for the treatment of their diabetes. This is a program that covers the cost of an insulin pump and the therapy that goes with it. The cost of an insulin pump and supplies is thousands of dollars a year. Without this program, most people would not be able to afford to continue with insulin pump therapy. To hear that the UCP government met with lobbyists and fairly soon afterwards decided to cancel the insulin pump therapy program is shameful. The insulin pump therapy program needs to grow. It needs to include newer insulin pump devices. It needs to include continuous glucose monitoring systems, but not at the cost of losing a program that allows them to keep healthy. Having a device such as a tandem insulin pump within the Insulin Pump Therapy Program is great news. But without having a continuous glucose monitoring system, having it covered by this program, it is a useless device. The tandem insulin pump and other pumps like it require a CGM for it to be fully functional. Without a CGM, it just doesn't work the way it's meant to be. The whole point of this type of pump is for it to sync with the continuous glucose monitoring device in order for you to make the best real-time decisions for your health as you see it. We are confused as to why the UCP government would meet with lobbyists, add an insulin pump to the program without a continuous glucose monitor, push the financial burden onto the patient, and call it a day. This is just not acceptable. I think it is easy to say that we welcome changes to the Insulin Pump Therapy Program that update this program with newer devices, but no changes should come at the expense of a person on the program. Type 1 diabetes, as we all know, is a costly disease, an autoimmune disease in which anyone who has it got it at no fault of their own. Going to an additional insurance program that has copays and premiums and other charges is just not acceptable, when this program has been fully covered for over the past 10 years. And we are happy the UC government heard us and paused the cancellation of the Insulin Pump Therapy Program, stating they needed to do more consultation. But where is this consultation? We have heard nothing more than the Q&A session they dubbed as a consultation on the costs of the Alberta Blue Cross program they would like to institute, but nothing more. We have asked to have a seat at the table with Health Minister Copping, but we have yet to hear back from him. Not only have we not heard back from him with our request to meet and discuss the Insulin Pump Therapy Program, but nobody has heard any updates from the Alberta government on the status of the Insulin Pump Therapy Program. As a person with type 1 diabetes that is part of this Insulin Pump Therapy Program and who is advocating on behalf of the 4,000 other people on insulin pumps here in Alberta, I ask Health Minister Copping once again to meet with us to discuss the insulin pump program. And it's time for Mr. Copping and the UCP government to meet with the people who this program directly affects.
Thank you, Leslie. So again, we are calling on Health Minister Copping to provide the information on what he talked about at the meetings where he met with lobbyists. And we are calling on him to put out a consultation plan for how he is going to meet and actually listen to Albertans like Leslie, who live with type 1 diabetes. With that, we're happy to take your questions.
All right, we'll start with questions here on location, and if you are on the Zoom or the phone, please use the *9 to raise your hand.
Hi, this might be a question for Leslie, but do you know what brands are offered? So if Tandem was the ones lobbying, like what brands of insulin pumps or what companies?
Can you repeat? Sorry.
Yeah, what companies or brands are covered? Like what pumps are covered right now? Do you know?
Currently right now is a Medtronic, a pump from Medtronic, a pump from Omnipod, and I believe the Ypsomed. I might be pronouncing it incorrectly.
Okay. And
they did tell us that
yeah?
the changes would include a tandem pump.
Okay. So Tandem would be included, but they didn't say whether.
Not right now, but when there are changes going forward, it would be included.
Okay.
But they aren't covering continuous glucose monitoring devices, which make that type of pump not functional to the extent that it needs to be.
And do you know how much those continuous glucose monitors cost?
Approximately $300 a month.
A month, wow. And are those used in the devices that are covered, or is it a new technology to have it sync with the...
It's a technology that syncs. So it's a little patch that goes on your arm, no different than the patch that you have for your insulin pump. And it goes on your arm and then they talk to each other.
Okay. And are those covered now?
No.
No. Okay.
Just the old school poke your finger glucose monitor.
Okay.
All right, thank you, Catherine. And we'll make another pass for questions on the Zoom and the phones. If you have a question, please use the *9 or raise hand function. And seeing no more questions, that will conclude our press conference. Thanks for coming, everyone.
Thank you.
For watching, and to learn more, check out albertasfuture.ca.